It's time again for Medical Monday right here on eRadio, and today ophthalmologist Dr. Dylan Joseph will talk to us about PRK. I'm going to leave the full name to him to pronounce. Big hello to you, Dr. Joseph. How's it going?
Yes, hi there, Jan. Had a good weekend, thank you, and I'm excited to get back to another week at work. How are you?
I'm good, thank you. Also had a good weekend, well rested and ready for the new week. I just can't believe it's almost July, but anyway. PRK today, what is it? Can you give us the full name?
Okay, the PRK is an acronym. It stands for Photo-Refractive Keratectomy. A big word, basically, but the photo means light. Refractive means we're changing the shape of the cornea to bend the light rays to fall on a good spot. And keratectomy means we're removing corneal tissue. So PRK is actually the first format in which laser vision correction was used. And that was done way back in the 80s. And obviously, modern day lasers have changed quite significantly in their profiles, but it still remains a very current modality of treating refractive errors, being short-sightedness, astigmatism, farsightedness, or a combination of them. So that's essentially what PRK stands for.
Okay, and Dr. Joseph, why would I have PRK?
So 30 years ago, and still today, some practices have a PRK as their default treatment for laser vision correction. But with the advent of mechanical keratomes, which created LASIK flaps, and then now more modern-day femtosecond lasers, which create the flaps with gas or with laser, so there's no blades, that fast became the go-to modality of vision correction if the patient was a good candidate, because the visual recovery is so much quicker, there's minimal discomfort. It's that wow factor that people are looking for. But with regards to PRK, we use this in patients that have either suspicious-looking corneas or the corneas are too thin to create a flap on. Remember, when we're creating a flap with LASIK, we're actually taking out of the picture, in inverted commas, about 20-25% of your corneal tissue, albeit replacing it. You're still changing or altering the architecture of the corneal tissue. So in patients where you're worried about altering that corneal structure, you rather do a surface treatment or a photorefractive keratectomy where there's no LASIK flap cut. And at the end of the day, your visual results are going to be the same. There's just a very different recovery period with regards to PRK. I was always told, and I remember that dictum, it's not going to be a practice builder, for two reasons. One, it takes very long for your vision to recover after PRK, about 6 to 8 weeks minimum, and usually only about the 3-month mark do we have really valid visual data. And secondly, it's uncomfortable. How we describe PRK is, a bit of a gross terminology is falling off your bicycle and getting road rash, falling onto the tar and you get road rash on your arm or your leg. What have you done there? You've taken that top layer of skin off your leg or your arm. And that's essentially what we're doing in PRK. We're just taking away that top layer of cells. You don't feel an absolute thing because you're anesthetized completely. But after the surgery, those cells need to regrow. They need to regenerate. And how do you feel day 1 or day 2 after falling off your bike? Even though you've got a bandage on, it's not so great. It's uncomfortable. And that's the second problem with PRK, is the discomfort factor for 2 or 3 days. It feels like you've got sand or grit in your eye.
Ah, okay. So how does PRK compare to LASIK?
Right, yeah. So once again, very good question. In PRK, or photorefractive keratectomy, we have methods of debriding or removing that top layer of cells I was just telling you about. So that top 50,000th of a millimeter of the cornea, we can either use alcohol to remove those cells. We can use what's called an Amoyal's brush, which is a fast rotating brush to remove those cells. And then we get what's called the Bowman's layer right underneath that epithelium, which once we've removed the epithelium looks nice and shiny and it's bare. And that's where we start doing the laser treatment. So with PRK, we've literally only removed that top 50,000th of a millimeter of the cornea. That's not a problem, because like tissue, like cells on your arm, it regenerates if you've had a wound. Those cells regrow. Whereas with LASIK, in the older days, we used to create a flap. So we used to pass what's called a keratome, an oscillating blade, over the surface of the eye to cut a predetermined depth flap of 120 microns, 130 microns, which is only about 20% of the cornea, but that flap is then lifted and put back down. Today, as we use in our practice, is modern-day femtosecond laser technology. No longer use blades. We can position the flap anywhere we like, at any orientation, put the hinge anywhere, and customize the depth, all customized to you, to your eye. And once that flap is back down in place, the healing time is very, very quick, as opposed to the PRK, which I've already mentioned. So those are the essential differences between the two. And LASIK is a very quick visual recovery. So 4 to 6 days, you're seeing what your specs or your contact lenses gave you, whereas PRK is a longer visual recovery.
Okay, Doctor, well, let's talk about this recovery period after PRK. I think let's look at the first 6 weeks or so after surgery. What can I expect?
Yeah. So it's a classic conversation I have with my patients, and before surgery I tell them all, I say, listen, you are going to phone me in 2 to 3 weeks' time in a panic and say you still can't see. But I'm telling you here today that for 6 weeks you are not going to be seeing very well. And then everyone says, but am I going to be seeing better than what I did without my contacts or without my glasses? And I'll say, you're probably going to be seeing better, but your quality of image is not going to be there. It's still going to be hazy. It's still going to be grainy. You're just not going to be satisfied with your vision. And then people ask me, well, what can I do? Can I drive in those first 2 or 3 weeks? And if it's a small amount of treatment, or if you've recovered quicker than other people, and we feel that you are safe enough to drive, then absolutely, you can continue to drive. But it's a rocky road that first 6 weeks. So from a vision perspective, it's up and down like a yo-yo until about 6 weeks, and then it starts stabilizing. And in that first 3 to 4, 5 days, it can be quite uncomfortable, as I've said, like grains of sand in your eye. We do put a contact lens on your eye to help those cells regrow, which is then removed at 5 days after surgery. But that is typically your first 6 weeks. And like clockwork, everyone phones at about 2 or 3 weeks. And they think they're the exception to the rule. But in PRK, the rule is 6 weeks minimum.
Oh, yeah. So I can imagine what that must be. Like the patients, they phone you and say, listen, Dr. Dillon, I can't see. Yeah. What's happening?
Yeah, it's not fun. And that's also why PRK is not a practice builder. It just isn't. Obviously we do PRK for a reason if the patient needs it. But with the advent of modern-day eczema and femtosecond lasers and our criteria that we look at to assess your suitability for LASIK, a lot of people end up being LASIK candidates. And that's why the visual recovery is faster and they're generally happier patients quicker.
And when we talk about the recovery time now, let's go to 3 months after the surgery. How's the picture looking now?
So between 6 months and 3 months, you're generally starting to stabilize from a vision perspective. Often people are slightly dry in that time as well, which can, as we know, impact your quality of vision. If you've got a dry surface of your eye, you're not going to see very well. So it's still very important to use plenty of preservative-free lubricants, keep your omega-3 capsule intake up, drink lots of water, 1.5 to 2 liters of water a day. But this is generally when you're starting to settle into your vision and starting to enjoy it. And if we've done blended vision, it can be a little more frustrating, obviously, because one eye's been set more for the distance and intermediate, and the other eye for intermediate to near. So blended vision PRK patients can often take a little bit longer to settle down. But then by the 6 month mark, if you look at the data between PRK and LASIK, there's really an insignificant difference between the two in terms of visual outcomes.
Wow, fantastic. And the last question for today, Dr. Joseph, the visual results, are they the same as LASIK?
Not in the initial period, certainly not in that first 4 to 6 days, and not even in that first 6 weeks, no. The very lucky occasional person who recovers quickly, that epithelium that we remove, if you can imagine, it's millions of cells that need to remesh and regrow, and they've got a very specific genetic pattern that they rearrange themselves in. And that pattern is responsible for good quality vision. So until they're in that arranged pattern, you're not going to see well. So, and that is a 6 week process minimum, and very often up until about 3 months. So when you do PRK, the take home message is that you've just got to be patient, and as long as that is understood between the doctor and the patient, then that journey we walk together. And it is a frustrating journey, but that's what we're here for. We only do vision correction, and if you're struggling, we're here to take your calls or to take the email and to talk through it.
And that's PRK in a nutshell today on Medical Monday. Dr. Joseph, just one more question. How do we get in touch with you?
Yeah, we're based in Knysna, 4 Barracuda Street at the Advanced Health Surgical Centre. Our website is www.drdillanjoseph.com. Our email address is info@drdillanjoseph.com, and you can call Mariska on 044-150-0085, and she'll be happy to take your questions. And we have a YouTube channel up and running where you can find all our podcasts here. We've downloaded a lot of very useful videos that we do in the office as well, discussing these various eye conditions. So please go and have a look at them and follow the YouTube channel. We've also got an Instagram and a Facebook account where we post a lot of good, useful info regarding vision correction. So go and check it out and go and give us a like.
Excellent. Dr. Dylan Joseph, as always, thank you. That was very interesting, and thank you for your time.
Pleasure, Jan. Great chat. Have a good week.
You too. Until next time.
Take care.